Hey friends, I am Dr. Ann, an anesthetist, and welcome to another dose of happiness and health. Today we are going to be discussing how we're going to be choosing either you will be getting a general anesthesia for your surgery or regional anesthesia for your surgery. Before we actually go into the comparison between general anesthesia and local anesthesia, I thought I'd first take a minute to share about what general anesthesia is and what regional anesthesia is for those who do not know what it is and all the technical terms behind it. General anesthesia is when you are given medicines intravenously, or you might be given anesthetic gases to make you sleep, and you will also be given muscle relaxants and medicines for pain, so that you will be asleep during surgery and you will be woken up after the surgery is over. So that is what is general anesthesia. And then coming to regional anesthesia, in regional anesthesia you will not necessarily be given sleep medication. If you ask your anesthetist, they will give you sleep medication, but other than that you won't be given. Only the nerve supplying a particular part of the body, like if you have surgery in your arm, the nerves supplying your arm will be anesthetized. If you have surgery in your legs, your spinal nerves will be anesthetized. So before I actually go into the comparison of general anesthesia and spinal anesthesia, I will also like to add another thing. It will mostly be your anesthetist who will be deciding whether to opt for general anesthesia or regional anesthesia for you, not the person who is scheduled for surgery, because your anesthetist will have a look at your medical records and they will assess your health condition to see how fit you are. Like for some reasons you might not be fit to have a general anesthesia, so you will have to be given regional anesthesia, or in some cases you might not be fit to have regional anesthesia, and so you will have to be given general anesthesia. So I would like to emphasize again, I am talking about the pros and cons of general anesthesia and regional anesthesia, but it's always best that you talk to your anesthetist, because before the surgery, not on the day of surgery, when you go for your pre-anesthetic checkup, I advise that you talk to your anesthetist, because they will be deciding what anesthesia to give, and they will be deciding what anesthesia to give not on the day of surgery. They will be deciding on the day you go for your pre-anesthetic checkup. So that is when you have to talk to your anesthetist. In case you have any concerns, like if you really don't want general anesthesia, you can tell your anesthetist, we will definitely accommodate you. Or if it's just a single part about regional anesthesia that you don't like, if you share your concerns with us, we will also be able to address this and alleviate your fears. And so talk to your anesthetist. We are there to help you, and there is no reason for you to be afraid of your anesthetist. Your anesthetist, as much as possible, they will be opting for regional anesthesia. That is the rule, because the complications related to regional anesthesia are less compared to general anesthesia, and the hassle is also less, and the advantages are also more when it comes to regional anesthesia. So most probably you will be having a regional anesthesia, but there are times when regional anesthesia is not possible, and in those cases you will be given general anesthesia. So especially in this COVID times, and even previously before COVID, if you had any respiratory illness, most often your anesthetist will be opting for regional anesthesia, because first point, you will be spreading your infection to others in the operating theatre. So if you have any respiratory infections or any respiratory conditions, like you might have emphysema, COPD, bronchiectasis, where your lung is affected, and in those cases it's not advisable to be given general anesthesia, because the anesthetists need your lungs to be performing well if you have to be given general anesthesia. The main point is, in these COVID times, you will probably be given only regional anesthesia, or you will have to wait for your infection to go down, and after that you can schedule your surgery if you are having an elective surgery and it's not an emergency. So at this moment I would also like to mention about the study which was done among patients. Some were given general anesthesia because they were asked general anesthesia, and some were given regional anesthesia because they were given regional anesthesia. And on asking them what did you like about the surgery, I mean, how did your surgery go? How did your surgery go? Both of them said that the surgery was perfectly fine. We didn't have any discomfort, like being in a general anesthesia, we didn't have any discomfort during the surgery, and being under regional anesthesia, they also said that they didn't have any discomfort during surgery. And then on asking those people, so why did you choose to go under general anesthesia? The one thing that all of them said that we are afraid of needles and all the procedure like instilling an epidural catheter or giving a spinal injection. All the people who opted for general anesthesia, they didn't really like the process in which you are given regional anesthesia. And they said that, and also about being awake during surgery, because it's a very different feeling, right? If you're having surgery in your arm, just this one arm is numb, and then your whole body is just normal. You can feel all the other parts of your body except this arm, and the surgeons are operating on your arm. So that's those people also said that that was a very weird experience to stay awake during surgery and have this one part of your body operated on. And there's also another factor about you being awake, like you will see everything that's going on. You will see all the surgeons, the nurses, the technicians, and everything. Like you might even see blood. So, and you will hear everything that they're talking. Although what the surgeon is talking, what the people around are talking, what the anesthetist is talking. The people who opted for general anesthesia said that that was very stressful for them, and that is why they opted for general anesthesia. So before I go into what the people of regional anesthesia said, I would like to add that if in case that is your fear, that being awake during surgery, I suggest that you talk with your anesthetist about it, because we can give medications to make you fall asleep, so you won't be able to hear anything that's happening, to see everything that's happening, and it's as simple as that. Talking with the anesthetist will make all these problems go away. So if that is really your fear, I suggest you talk to your anesthetist, and you can still have your regional anesthesia and sleep during surgery, and it's fine for everyone if that's a concern. And now coming to the patients who opted for spinal anesthesia, when asked about why did you choose spinal anesthesia instead of going for general anesthesia, almost all of them said that they were afraid that they won't wake up after general anesthesia. Okay, that is a fear, that is a very rational fear, and you might even have this fear, and that's why you're watching this video. Throughout my career, I have not seen anyone who has not woken up, and unless you're very, very sick or you have a complication, that's not a possibility. But if you are very sick and you have a complication, you might not wake up even if you are under regional anesthesia. So it doesn't play a role. That is not a rational fear. If you have such a fear about general anesthesia, I suggest you talk to your anesthetist again. You can talk about their experience with the theater and how they've seen patients so far, and almost all anesthetists will tell you that there's nothing to be worried about. It's something that happens all the time, waking up, going into anesthesia, sleeping, and waking up again after anesthesia, and it's nothing to be too concerned about. So talk with your anesthetist again during your pre-anesthetic checkup. So at this moment, I would also like to talk a little bit about something that's between regional anesthesia and general anesthesia. Sometimes your procedure might be very small and you might not have to be given a full-blown general anesthesia or a regional anesthesia. In that case, they might give a very small dose of general anesthesia And something like if you have a 15-minute procedure and that's all that's going to happen, they will not actually intubate you, like connect the ventilator into your into the tube in your windpipe. They just keep a device in your mouth so that it will breathe for you. That's called an LMA, and they will be giving the usual general anesthesia medications, and you will be sleeping, but you will be given a small dose, so you will be waking up. But this LMA, you can't be breathing on it for a very long time because it has its own pros and cons, and it's not possible to be like that. It's not safe to be for long periods of time. So in case you're having a 15-minute procedure and you're scared of needles, I mean, you can talk to your anesthetist and they might be able to give you a short GA, as some people call it, or total intravenous anesthesia. There are lots of names, so you can discuss with your anesthetist about that also. So I hope I cleared the doubt that you came with watching this video. If you can choose between choosing between general anesthesia and regional anesthesia. So if you want to hear me talk more about anesthesia, don't forget to subscribe to my channel. I upload every weekend. So see you again in the next video. Bye.